morning, everyone. This is Jennifer McKeithen, Communications and Marketing Director with Trillium Health Resources. Thank you for joining us today. We will be sharing about the changes with the new Tailored Care Management services that go live on December 1st and also the upcoming 1915I services with this presentation today. And we will be recording this and posting it onto our website after, along with any questions that are collected during the event. We will ask for you, excuse me, to enter those questions by typing them into the Q&A block. You should see that at the bottom of your screen. And we will be pausing in between the end of each slide so that we can ask those questions as we go along rather than having to wait until the very end to ask those questions. And that will be the only way you can ask questions. The participants will not have the ability to unmute themselves and so we will be taking questions that way. And we would also like to ask that any questions are about general topics and to not share any personal health information through those questions. You're definitely welcome to reach out to Trillium through our call center or your care manager to ask any kind of specific details about your personal situation. And if there are any questions that come up that we either do not have time to answer or that we need to research for more information, we will post a list of those along with the recording of the event on our website. So the presenters today will be from our Population Health and Utilization Management teams. We have Akan Ayamu, who is the Associate Vice President of Population Health Clinical Operations. Sharon Cook McEwen, who is our Utilization Management Director. And Deborah Kinnear, who is our Utilization Management Director for the IDD population. And this is a brief outline of some of those topics that they will be sharing about with you today. So with that, we will get started with Akan.
Good morning, everyone. My name is Akan Iyamu, and I'm the AVP of Population Health Clinical Operations. I'll be discussing some of Trillium Taylor Plan's updates. And without further ado, if you've not heard, North Carolina Medicaid announced the launch date for Taylor plans has been moved to April 1st, 2023. However, some services like Taylor Care Management are starting this year on December 1st, 2022. We will share more about those services with you today. Taylor plans will coordinate integrated services for physical and behavioral health care needs, along with pharmacy services for those on Medicaid with serious mental health, substance use, and IDD needs. We will continue seeing members in North Carolina Medicaid Direct. For state-funded recipients, services will be for behavioral health and IDD needs only. We will launch with the launch of Trillium Taylor Plan, we will start exciting new programs and embrace whole person care. Here are a few changes you'll see. New terms, including Medicaid members and state-funded recipients. There will be separate handbooks for members and recipients to review appropriate information and requirements. The launch of our 24-hour behavioral health crisis line and nurse line. New benefits listed on our website for physical health care and pharmacy services. North Carolina Medicaid Ombudsman Program, where you get help with questions and issues. Our Ombudsman is an impartial third party who can help answer questions and resolve issues. New ways to improve your well-being through health promotion materials such as diabetes resources, population health initiatives, and tobacco cessation program. So Tailored Care Management, or TCM, is a service offered to eligible members with special needs. Care management helps ensure that members with complex mental health, substance use, and IDD needs receive appropriate assessments and integrated treatment planning and are linked to the right services. The care manager works with you and a team of medical professionals and approved family members or other caregivers to consider your unique health-related needs and find the services you need in your community. Your care manager, team of medical professionals, and any other approved caregivers consider your unique health-related needs. The care manager knows what resources are available in your community and will work with local providers to get you that help that you need. Last week, Trillium started mailing letters to eligible Medicaid members who were assigned to Tailored Care Manager. Now, this letter includes details about TCM and how we'll work with you, and also instructions to follow if you do not want a tailored care manager.
Con, I'm just pausing for a moment. I have not seen any questions come in, but just wanted to remind that if there are any questions, we can certainly pause at the end of each slide, but so far there have not been any.
Thank you. Okay, so I'll go ahead. And so how is this different from care coordination? Care coordination helps organize your health goals and information to help you achieve safer and more effective care. These services may include, but are not limited to, identification of health service needs, determination of level of care, addressing additional support services and resources, or monitoring treatment attendance. Tailored care management is a more in-depth service where the care manager works with a full team of healthcare professionals and also addresses unmet health related resource needs like transportation or housing. So you may ask, if I get state funded services, will I get tailored care management? Well, case management for adults and children with behavioral health needs. Some adults and children who have mental health and substance use disorder needs but do not have Medicaid may be eligible to get case management services. A case manager is a specially trained behavioral care worker who helps you and your healthcare providers to make sure you get the right care when and where you need it. The care manager knows what resources are available in your community and will work with local providers to get you the help you need. Care management for adults and children with intellectual and developmental disabilities or traumatic brain injury. Some adults and children who have IDD and TBI conditions but do not have Medicaid may be eligible to have a care manager who works with Trillium. If you qualify, Trillium will match you to a care manager that has specialized training to meet your needs. So you may ask, where will I receive tailored care management services? You have an option to select where you receive care management services. You could receive it at an Advanced Medical Home Plus, AMH Plus. Certain primary care providers across the state see a lot of Tailor Plan members. These providers are called Advanced Medical Home Plus and have a lot of experience working with people with behavioral health conditions. intellectual development disability, and a traumatic brain injury. And will have care managers to help their patients. A local behavioral health IDD or TBI service provider is another outlet. Certain service providers with experience working with people with behavioral health conditions, IDD and TBI, will work with Trillium to provide tailored care management for its members. These organizations are called the Tailored Care Management Agencies. And lastly, we have the Trillium Plan-based care management. Your care manager will work with Trillium and help you coordinate and connect with your local services to address your health care related needs. So what can your care manager do for you? They're going to be able to help you arrange your appointments and transportation to and from your doctor. They'll support you in reaching your goals to better manage your ongoing health conditions. They'll answer questions about what your medicines do and how to take them. They'll follow up with your doctors or specialists about your care. They'll connect with you to help. Help connect you to helpful resources in your community and help you continue to receive care you need if you switch health plans or doctors. As part of TCM process, your care manager will meet you regularly, either in person, over the phone, or using video chat. Your care manager will also have regular conversations with your tailored care management team to make sure it's being helpful and you're making progress on your health goals and getting you the services you need. In November, Trillium is mailing letters to all eligible Medicaid members to let them know who their assigned tailored care manager will be. However, you will have a chance to change your TCM if you choose. Call Trillium's member and recipient services at 1-877-685-2415 or complete the form in the member portal on Trillium's website. You can choose not to have a care manager at any time by calling the member and recipient services at the same number or completing the form on the member portal. Jennifer, do we have any other questions?
No, I was just going to say we still have not received any questions in the Q&A.
Okay, so I think at this point, I'll hand over to the next speaker. Thank you.
The next speaker will be Sharon. Hey.
Hello, I'm Sharon Cook McEwen, the Director of Utilization Management, and I want to give you some information about the 1915 I services. The 1915 I services are for Medicaid members who want support to live in their home communities. They are replacing the 1915 B3 services that are used today. They are also called Home and Community-Based Services, or HCBS. Most of the services will look the same with some changes, such as adding availability for those with substance use disorder or traumatic brain injury. The new 1915 I services are scheduled to be available next year when the Centers for Medicare and Medicaid Services gives their approval. The related 1915 B3 services will be available until the new 1915 I services are approved. These services are non-medical behavioral health services, such as supported employment. They are provided at a member's home or in the community and are not for members living in an institution. These services will include supported employment, individual placement support, individual and transitional support, respite, community living and support, and community transition. Deborah Kenyer will give you a little bit more information as to who is eligible for 1915 I services.
Good morning. I am Deborah. As you see on the slide, these are the individuals who are eligible for 1915 I services. Those who are Medicaid eligible, those of the appropriate age, as I will give you a description of the services, diagnosis, that have the appropriate diagnosis, and also those are home and community. Member eligibility will vary based on the service, but all are available to those receiving Medicaid and Medicaid Direct, or who will be on the tailored plan. A member's age, diagnosis, and living situation will all be a part of the service authorization request. As these services are known as home and community-based services, they are not for members living in an institution. Your care manager can answer any question you may have about 1915 B3 services you are currently receiving. The 1915 B3 services will remain in effect until CMS approves a start date for the new 1915 I services. As mentioned before, the services that will be available are supported employment, and that's a service description such as includes job development, job training, job support, individual placement support, individual and transitional support, respite, community living and support, and community transition. Thank you.
Thank you, Deborah. This is Jennifer again, and I will close us out with some of the steps you can take before the Taylor plans launch on April 1st. And one of the ones you can do is register for upcoming information sessions. We have a variety of topics we plan to host additional information sessions about, and they will take place next year in February and March before the launch on April 1st. So be sure to visit our website and register for those events once they are added to the webpage. And as mentioned before, Trillium has started mailing letters in November to those members who are eligible for tailored care management assignments. And if you did not have a chance to make that choice during the choice period, you will be getting that notification in the letter. You will be able to change your assigned tailored care manager if you want to. And you can do this either by calling Trillium at 877-685-2415, or you can visit the member portal on our website. It is in the For Individuals and Families section, and then you can select Member and Recipient Portal from the right menu to complete a form if you would like to request a change to your TCM assignment. And as just noted, we just wanted to reiterate that you will always have the option to stop receiving tailored care management if you choose. And you can either complete the form that will be mailed with the letter, you can visit the member portal and complete this task on the website too, or you can call Trillium to request to stop getting tailored care management. Next year, the enrollment broker in the state will also be sending out additional letters. Since there was a delay, they will be sending out the letters again. If for any reason, if any members are going to be notified that they are getting placed on the standard plan and you have reasons to request remaining in the tailored plan, you can follow instructions in the letter to make that request. And in addition, next year, there will be a new choice period for choosing your primary care provider. If you had made that choice prior to the notification of the delay, then you do not need to do anything else. That request has been noted. But if you did not have the chance to do that, you will be able to follow the instructions in the letter next year for making that selection. And there will be a new deadline as well before the April 1 launch in order to make that selection. And on the homepage of the Trillium website, we also have the option for members to sign up to get either email notifications or text messages. For both of these, we do not send out communications more than once a month, but they're great ways to get additional information and updates from Trillium as well throughout this process. And again, we have recorded this presentation and we will post it on our website. We did not see any questions that came in through the Q&A, but we still have another minute or so if anyone has thought of anything since we started. But if you have questions that come up over the next few weeks or think of something later, then you can always email us at info@trilliumnc.org and we can add them to a Q&A that will be posted as well. And we will get those up once the recording is completed. So in the next week or so, we will have those posted on our website as well. And that is the end of our presentation. We have not seen any further questions come in, so we can close that out. I spoke too soon. We just had one pop up. So the question is, if a person is currently receiving Medicaid and receiving services at a FQHC for medication-assisted treatment, but not any other services through Trillium, will they receive letters regarding tailored plan? And I'm not sure if anyone has details regarding this specific example to provide a concrete answer. We had been told previously that eligibility for the Taylor plans are best to ask directly to NC Medicaid or the enrollment broker directly. Trillium does not make that designation. That is a state level decision. So if anyone has any additional insight to add to that, we can certainly post the contact information for those two entities when we post the Q&A on the website too, unless anyone has any other clarifying information that perhaps contradicts what I just said. But that was my understanding. Great. And we will get that information shared too with the Q&A. So. All right, I do not see any more questions after that first one. So thank you very much for your time today, and be sure to watch on our website as we get the dates and registration information shared for our upcoming information sessions that will take place next year. And other than that, thank you so much for joining us today, and I hope everyone has a wonderful Thanksgiving. Thank you.
Thank you.